Welcome Dr. Bikash Mishra sir, Chief Consultant Neurology, Apollo Hospital, Bhubaneswar. I am Dr. Anshuman Das, moderator of camera for this Facebook live session on meningitis. Sir, what is meningitis?
Meningitis is something called brain fever, in which the brain gets affected because of various reasons, including infections, tumor, or any other cause. There, the patient has to present with certain kind of symptoms in which we say that the patient is suffering from meningitis or brain fever. The statistics in Indian patients is not very robust. However, if we see it on an average, in every 10 patients, 2 or more patients are suffering from meningitis or meningitis related symptoms. So, in hospital based setups, we see meningitis more often during the seasonal changes area times.
What are the causes of meningitis, sir?
You asked a very good question. What are causes of meningitis? If we look at it, the commonest cause are the various kinds of infections, be it bacterial, viral, or parasitic infections, can be tuberculosis. But besides that, they can have other parasitic diseases, and besides that, they can have other kind of tumor related diseases. Say, suppose somebody has got tumor and then they can present as meningitis. We recently had seen such patients very often. And besides that, they can have due to secondary toxins or other kinds of, see, cerebral malaria and typhoid diseases can be cause of meningitis variously seen. The diseases are widespread, however, that can be localized to a particular area depending on the organisms affecting such people. Recently, you must have heard about encephalitis outbreaks in Uttar Pradesh or be it in other places, Bihar. This has been seen that probably because of the toxins also it can happen. Besides, the viruses are the causes. Recent the hype has been created because of the China people getting affected with coronavirus is again another virus related meningitis or meningoencephalitis disease.
So, how do you diagnose it?
When we see such patients, first we see clinically how they are presenting, like what are the signs and symptoms they are presenting. If somebody has got severe headache, vomiting, alteration in their sensorium, they become more drowsy, or they can have seizure related issues such as fits, or they develop any kinds of deficit, be it in the forms of decreased vision or hearing or inability to speak or paralysis of one side or paralysis of all the hands and legs, and patient is having other signs and symptoms, then we suspect that patient is having brain meningitis or brain fever. In such patients, the modalities of investigations are the routine blood test that we do. Besides that, we do CT scan or MRI of the brain depending on the availability of the instruments. We do a fundoscopy where we see that the brain pressure is high or not, and then we go for a lumbar puncture in which a small needle is put into the backside of the patient, and we drain out a little bit of fluid which is circulating throughout the brain and spinal cord, and we send it for the tests, including various panels in which we diagnose that the patient is having bacterial disease or viral disease or tuberculosis, or for say the other kinds of diseases.
Sir, is it curable or not?
It is certainly curable in most of the patients depending on the cause that the patient is suffering from. If the patient is having bacterial or tubercular meningitis, majority of the patients they recover and they come out with very little of deficits or no deficits at all. And they are not going to be recurrent enough depending on the clinical condition of the patient. The viral diseases, out of which very few are treatable and many are also self-limiting. So be it HIV, which HTLV virus, which coronavirus, or you say Japanese encephalitis, herpes encephalitis. These are the viral diseases out of which herpes encephalitis is very common, rampantly seen, and it is treatable condition because the treatment is there. However, the patients can have residual deficits depending on the size and site of the brain affected. If the brain is affected extensively, then many of them they can have residual deficits, be it in forms of weakness of one side of the body, understanding, memory aspect, or they can have seizure later on in their life. And And if they have severe involvement, they can go into a vegetative state. The severity and the treatment onset, if it is started, the treatment is started early, then obviously the recovery is much better than treatment started late. Very often it is seen that the patient reached to hospital very late because of the maybe the diagnostic facilities are not there, the diagnosis has not been made properly, or there is a wrong diagnosis. In that case, the patient who have extensive disease and then they suffer from residual deficits.
So, how does hospital cater to such patients?
Yeah, it is very important that if you have facilities in your hospital, then the outcome is better. It has been proven many times. The hospital has got the hospitals which has ICU facilities, has got a teamwork. Say the terms of ICU consultants, neurosurgeons, neuroanesthetists, neurologists, and the physiotherapy units, and the trained nurses and the technical staffs. They always mean a lot to such patients, and the outcome is invariably better. And the hospital has got various monitoring procedures, be it in the intracranial pressure or be it successfully seeing the patient for any deterioration any time, and then certainly and appropriately treating it promptly is very important.
So, how expensive is the treatment?
Unfortunately, in the times to come, it is becoming more and more expensive. One, the reason is the diagnosis is made more perfectly and more precisely. So you need to cater to such patients with a specific kind of antibiotics and antivirals and other medications. Second is the drugs are becoming more and more expensive, and because of the monitoring and ICU care, things are becoming more expensive now. The exact figure given is a difficult job, because once we see a patient of meningitis who has got severity, then obviously the treatment is expensive. There is a longer in the hospital stay, and however they can have other additional complications during the treatment modalities. If it is not there, if there is a mild involvement, then 7 to 14 days of hospitalization and complete cure is possible.
Sir, can it be treated properly in India or one needs to go outside?
It can very well be treated throughout India. The facilities are available everywhere. The quantum of the facilities available might be different from different hospitals, but the treatment is very much possible in India. No one need to go abroad to get it treated. And the diagnostic facilities are now getting more and more decentralized, and the research medical centers are there. There are centers which are private hospitals like Apollo Group of Hospitals has got all the advanced technologies and modalities to treat, diagnose them and treat it. So the things are very much available in India.
Sir, how someone will suspect meningitis? What are the signs and what are the tests done?
As I had answered already, the patient, those who have severe headache, neck pain, they have any kinds of decrease in the sensorium, say they are becoming more drowsy or stuporous, you wake up, they are not getting up, patients are having seizures, they are throwing fits, and the patients are having any deficit in terms of paralysis of one side or the either side, or all the muscles, all the nerves of the body. And if the patient is having in a comatose state, the possibility of diagnosis of meningitis is very high.
Thank you, sir, for such wonderfully explaining the basics of meningitis.
Thank you.